Most men worry about their prostate only when there's a problem. But what if your daily habits could be silently shaping your long-term health? You need to hear this. As a men's health specialist, I've seen the confusion and quiet anxiety that surrounds one private question. What really happens to a man's body when he releases too often? There are all kinds of stories out there that it causes inflammation, that it weakens your system, that it might even raise your risk of something serious like prostate cancer. For years, these warnings have been passed around without solid proof, just fear, hearsay, and outdated advice. But what if I told you that science has finally caught up with the rumors, and that the truth isn't just different, it's the complete opposite of what most men believe? To understand the full picture, we first need to look at one key part of the male body, a small walnut-sized gland located just below the bladder, the prostate. Its job to help produce the fluid that supports reproduction. But its health plays a much bigger role than most men realize, especially as we age. So here's the real question. Could something as common and natural as regular release, whether with a partner or solo, actually protect your prostate instead of harm it? To answer that, let's look at one of the largest, most respected studies ever done on this topic. It comes from the Harvard School of Public Health. Not a small survey, not a quick experiment. This was a long-term study that followed nearly 32,000 men over the course of 18 years. What were they tracking? Among other things, how often these men experienced ejaculation, and how that might connect to prostate health later in life. The results? Nothing short of eye-opening. Men who reported 21 or more ejaculations per month had up to a 33% lower risk of developing prostate cancer compared to men who only had 4 to 7 per month. That's not a minor difference, that's a massive shift in risk. Let's pause here. Did releasing more often somehow protect their prostate? And if so, how? There are 3 leading theories scientists believe could explain this link. 1. Natural cleansing. Think of your prostate like a set of pipes. The longer fluids stay in those pipes, the more buildup and stagnation can occur. Regular release helps clear out old cells, toxins, and potential irritants, keeping things clean and reducing the chances of harmful changes in the tissue over time. 2. Healthy cell turnover. Every time our cells divide, there's a small chance of error, tiny mutations that, if left unchecked, can lead to disease. Regular ejaculation may help keep the prostate's cellular cycle in check, replacing old or damaged cells before they become a problem. 3. Reduced inflammation from lower stress. Finally, we know that stress fuels inflammation, and chronic inflammation is one of the biggest risk factors for many types of disease. Regular sexual release, solo or not, is linked to stress reduction, which in turn can lower the body's overall inflammatory response. In short, it's not just about pleasure. It's about cleaning the system, supporting healthy tissue, and reducing silent inflammation. That's what the science is telling us. So now let me ask again. If something this natural and accessible might actually lower your risk of prostate issues, shouldn't we stop treating it like a secret shame? Now, does this mean that frequent release is some kind of magic shield against prostate cancer? Not exactly. This research shows a strong connection, yes, but connection doesn't always mean direct cause. Men who ejaculate more often might also be more active, have healthier habits, or manage stress better. It's part of the picture, but not the whole story. So what else matters when it comes to protecting your prostate? 1. Diet plays a massive role. A healthy eating pattern supports everything from hormone balance to cell repair. Foods high in antioxidants like tomatoes, watermelon, green leafy vegetables, and berries can help reduce inflammation. Look for nutrients like lycopene found in red fruits and omega-3s from fatty fish like salmon. 2. Stay active. Exercise doesn't just help you stay fit. It improves circulation, supports hormone balance, and reduces weight-related risks. Even 30 minutes of walking 5 days a week can make a difference. 3. Avoid harmful habits.
Chandler, what are you doing? Chandler! Oh my God!
Smoking and excessive alcohol are linked to higher cancer risks and poorer prostate function. If you're serious about long-term health, cutting back on both is non-negotiable. 4, get regular checkups. Nothing replaces professional care, especially if you're over 40 or have a family history of prostate problems. Talk to your doctor. PSA blood tests and digital exams help detect issues early when they're most treatable. Let's go back to the question that started it all. What does daily ejaculation do to your prostate? The answer, backed by some of the best science we have, is that it may help protect it, not harm it, not weaken it, but support it. It's not a license to ignore your health, but it is a reminder that something many men feel ashamed of may actually be doing their body a favor. This is why we need real, honest conversations about men's health, and this is just the beginning. There's a lot more men deserve to know, and we're just getting started. Stick around, you don't want to miss what's coming next. So subscribe, like, comment, and share with your friends right now.